and there's a big misunderstanding, and it's a big controversial and hot topic for many people in our field. And what I have to start by saying is that root canals are still the standard of care of getting people out of pain.
Welcome to the Fusionary Health Podcast. I have a special guest in store for you today, Dr. Maya Assi, and we're going to talk all about a topic you might not want to talk about, which is your teeth, going to the dentist, and understanding a completely different approach to our oral health, to our teeth health, and how we can manage our long-term vitality and health, and how that's tied to our oral health and our dental health. So welcome to the podcast, Dr. Maya.
Thank you so much. Thank you for having me on.
For sure. So I know that your office is in Coral Springs. I know you practice biological dentistry. I have been to your office and done a consultation and understood so much knowledge from you, which we will get into. But will you kick us off with explaining what even led you to studying biological dentistry and then what it is as well?
Sure. Dentistry is an amazing field, and dentists are constantly trying to take what they learned and perfect their craft. A lot of it is manual. A lot of it, we deal in millimeter science. And so up until 10 years ago, I took what I learned from dental school and, of course, learning outside with the evolution of dentistry, but I was really gearing myself towards perfecting my craft. It wasn't until something happened with one of my patients where we discovered B-cell lymphoma, and the only place that she had B-cell lymphoma was at a tooth, that I decided to do some additional research on the other side, the things that we heard about on the other side, but we really didn't have time to dig into, or we weren't really taught in dentistry. And so basically now I stand a biological dentist, where really it's dentistry, but it's a philosophy of care that strives to provide modern dentistry in the least toxic way possible with more modern materials, always trying to affect the biological terrain of the patient as least as possible with everything that we do, and making the connections between the mouth and the body constantly.
Wow.
So
that's fantastic. And I think most people listening to the podcast are going to say, what are you talking about? Your mouth is your mouth. Your body is your body. These two things are connected, but they're not that connected. And when you look at Ayurvedic medicine, traditional Chinese medicine, all of the ancient modalities and integrative medicine sciences believe that our oral health is directly tied through the meridian channels into all the other parts of your body. It's why from Ayurveda, I teach about tongue scraping, oil pulling. Imagine 5,000 years ago, they were like, you need to clean your mouth better. It's not just about the brushing. And so will you kind of go over that idea and that concept in case people have not heard about it? That,
Yeah.
Hey, what happens here happens everywhere.
For sure. We are all energy and vibration. That's the basis of life. And the way that we develop, all of our nerve systems will flow through the mouth. So energetically, the mouth acts as a circuit breaker down meridian points. And this is not woo-woo. This has been proven with electroacupuncture. So certain flows through certain teeth, if there's a chronic infection or what we call an interference, it could decrease the energetic flow to that specific organ system attached to it, and vice versa. It works both ways. So there definitely is an intricate connection between the mouth and the rest of the body. And because the mouth is so unique, part of it is outside body and part of it is inside body. So once you get to the mouth, you're really inside body, and it's the beginning of the gut. And so a lot of things begin in the mouth and end in the mouth. And that's why part of my mission is to educate people that I don't know at which point medicine separated the mouth from the rest of the body, but it is intricate part of the body. It is critical to health, and it is critical to health optimization as well.
You just said two such interesting things. It begins in the mouth and ends in the mouth. So in Ayurveda, I teach, oral microbiome is gut microbiome. It's connected. But yes, we very much forget the feedback loop coming back up and out, that it's not just what starts here. I teach it as like your oral microbiome. This is your tongue. This is your palate. This is informing the digestive enzymes that are going to be released in the gut. But of course, the opposite is true. Gut microbiome can affect oral microbiome. Level of inflammation in the body can affect level of inflammation in the mouth. And then another key thing you said was, I don't know when the mouth got separated from the rest of the body. It's true. If you look at insurance, everyone's like, well, do you want dental and do you want eye care? And I'm like, why are my eyes separate than my body and my mouth is separate than my body? You guys are kind of funny that we separated those out. So yeah, I mean, considering how integral oral health is, I wonder why we separated it. Do you know?
I honestly don't. I honestly don't know. It's a mystery to me because for me, obviously, they belong together. And
Yeah.
the more and more we make connections, the more and more we realize that everything we do at the level of the mouth affects everything upstream and downstream, metabolically, inflammatorily, even physiologically. A change in
Mm.
a bite can change the way your cervical spine, can change the way your hip tilts. We are all one system. And so, we should all practitioners get together more and collaborate a little bit better to take care of our patients as a whole, holistically.
I agree. When I go to chiropractic, sometimes they have put on gloves. They're working on my mouth, my jaw to release things. They're like, Shivani, a lot of your issue is your bite and your tension here and these kinds of issues. And it's unfortunate because as the patient, you're like, well, is my dentist going to look at this? A traditional dentist? No. You have to go to chiropractic for this. And there's physical therapy available kind of as well. But there's no like one solution for the mouth. And going back to traditional dentistry for a moment, when I went to the dentist as a kid, they would just put fluoride in the mouth. They'd give us these silver mercury fillings. I have 8 of them. You've seen them. I've got the silver fillings still in there. And that's why I came to you earlier this year. I said, it's on my life list to get these fillings evaluated. I did have a root canal as a kid. I ran into someone playing capture the flag and needed a root canal in my mouth. And it's kind of time. I know it's time. It's been time for over 5 years to actually go in and have a conversation. But as an adult, I am so afraid of the dentist. I avoid going. I'm like, I'll just take care of my mouth myself. I'm not going there. So I did go. I tried Invisalign. I've tried a few things over the last few years. But when I came to you, I found it fascinating the level of depth of conversation and knowledge and the complete total picture approach you have to, well, I'm not just going to take out your silver fillings. This is a huge project. We have to talk about pre-care. We have to talk about post-care. So will you kind of kick us off with root canals first? Then we'll talk about fillings because I think people they underestimate the issues with their root canals.
Well, yeah, and there's a big misunderstanding, and it's a big controversial and hot topic for many people in our field. And what I have to start by saying is that root canals are still the standard of care of getting people out of pain. And root canal specialists, the doctors who perform this, they perfect their craft and they take their job very seriously and they do the best that they can. They go in. What a root canal is a tooth is alive and has a live nerve in it connected to a lymphatic system, to the nerves that go backwards to your brain and all over the body. And when a tooth becomes irreversibly inflamed, or when the nerve inside the tooth becomes irreversibly inflamed or dead, then what dentistry has found is say, hey, let's get the patient out of pain. Let's go inside the tooth and take the nerve out, keeping the tooth and cleaning as much as possible. Then we'll stuff those canals and then the patient will still have the tooth to be able to bite on. It's a great service for a patient. However, dentistry is the only profession that leaves a dead organ inside your body. So what happens is for 2 reasons. One, no matter how great the root canal specialist is, they can never get to all of the intricacies of that nerve channel. So there's still some organic material residing inside the tooth, which is a happy area for bacteria to infiltrate and proliferate. And the second reason is the root surfaces are very porous. So whereas bacteria can re-infiltrate to the root canal system, macrophages, which are responsible for attacking them, are too large to get in. So it becomes kind of like a cat and mouse situation where inside the dead tooth, bacteria are proliferating, but the macrophages and your immune system, which is heightened because of that, cannot get in. So the destruction happens silently and chronically outside of the tooth. Meanwhile, those bacteria and pathogens not only they not only stimulate the body's immune system to respond, but they also release endotoxins into the body. Proteins like cadaverines, which come off of rotting flesh, get released into the body. And because it's still connected to the lymphatic system, it's circulating all over the body. So with my patients, when they have a decision to make, some patients still decide to go have a root canal, in which case they go out. I send them to the best people that I know in the area that are, work with integrity and do the best that they can with them and use a technology inside the tooth called a wave. I don't perform them here or have a specialist that performs them here anymore because I don't believe that that's the right way to go. However, my patients are given the informed consent and the decision. So if they choose to go out, I'll say, okay, listen, all of my research shows that this could potentially affect your immune system up to 70%. So from now on, every year, let's monitor and see how your body is doing. They very well know that I prefer that they don't have them done, but they're still given the choice to have them done. And not every patient that walks in with root canals gets them automatically extracted. We take a cone beam, which is a 3D X-ray. We evaluate how the body is handling that. And then we decide, are we going to monitor? Are we going to extract? If we're going to extract, are we going to replace them with something safe like a ceramic implant? So it's more complex than what it is. And that conversation, especially among the dental professionals that are on both sides of the story, should come together and have this conversation of common sense. We always want to do the best for our patients. And whereas root canals, in my opinion, I don't want a dead organ in my body. But some people are along their journey differently, and some people are okay with it, So it is not a one size fits all situation, and it never should be. But those reasons that I listed are the reasons why biological dentists are very wary and highly suspicious of root canals.
Sure. And I remember when we evaluated mine, you said, wow, this is one of the few I've seen. No infection, no problem. And I was like, oh, thank God.
Yeah.
What I don't want is my body. I mean, cadaver, the way you said that, I was like, that's disgusting.
Yeah.
That's an entity or a molecule or anything floating around in the system based on what's kind of dead and dying in the body.
Right.
And that it's going to, if it can put your immune system into overdrive. So your immune system's like, I've got something to fight here. And you don't even realize it's something dead sitting in your mouth that was from when you were a kid. I was in the 6th grade when I got a root canal. I'm 45 now. Like that's a long spread. But when we pause and look at our health as women and men in our 30s, 40s, 50s, and beyond, the level of autoimmune we're struggling with, sometimes you just cannot attribute where it came from. And so as someone who goes to functional medicine and loves doing all the testing, sometimes I sit across from a practitioner and I'm like, what else could it be? At this point, I've addressed everything on earth, leaky gut and everything. And finally they go, you know what? I think it comes down to your fillings. I think it's kind of like your last frontier. It's the last thing you haven't addressed. And when you start to do heavy metal testing on yourself, you'll see increased silver. Where else is that silver going to come from? I don't even usually wear true silver jewelry. I'm usually wearing either gold or just fun stuff. So talk to us about fillings for a moment, because my understanding is, and I think there's a whole documentary on it, that the people who made the material for fillings knew full well it was a bad idea. And still were like, let's just put this into all of dentistry and I don't know, probably billions of our mouths by now.
Yeah, so those fillings that you're referring to are commonly referred to as amalgam fillings, but really what they are mercury fillings because they're made up of more than 50% elemental mercury. Elemental mercury vaporizes at room temperature. And so from the moment that the filling was placed, a little bit of elemental mercury off gases into the biology every single time. If you look at the FDA's website, they acknowledge that to be true. But what they say is, yes, it's true. It off gases a little bit of mercury every time you brush, every time you grind, every time you drink something hot. However, we don't find these levels to be high enough to cause any harm. So the other consideration about these mercury fillings is this, is if I took that same mercury filling that my patient has in their mouth and dropped it down the drain in my operatory, I would get an EPA violation for that. So how is it okay for me to go in and drill them out of the mouth without extra precaution? It's
Yeah.
not. It's getting absorbed by the buccal mucosa. Some of it is getting swallowed by the patient. Some of it is getting inhaled by the patient and by me and my team. And so that's not okay either. So when we make the decision that they have to come out, or we make the decision like one person walks in with it broken and we have no other option than to, remove it and repair the tooth, then we're going to do something called SMART. Safe mercury amalgam removal technique. And that's a technique where we completely protect the patient's biology from this filling while we're working on it. So a rubber gasket gets placed around the tooth, oxygen gets placed on the patient's nose, so they're breathing pure oxygen. They're covered from head to toe. We're very covered too, wearing special masks. There's air filtration unit inside the room, surgical grade, and there's 3 suctions going on at the same time because of the elemental mercury and how it vaporizes. So that we have to be very careful for. So Minamata Convention just got together a few days ago, and over 125 countries made the decision that they're going to completely ban these mercury fillings. For us in the United States, it's going to take another 9 years for that to occur. And
Wow.
so there is consensus, and everybody knows that these are not good. As of now, about 40% of the dentists in the United States still place them. The government does subsidize them for low income populations and, believe it or not, for our military men and women. Well, I
Mm.
believe those two groups, everybody should get our best, but especially those two groups should get the best that we have to offer. And Mercury is not it. On top
Yeah.
of the fact that mercury breaks teeth over time because of how they're mechanically retained. So yeah, it's. Now, here's the thing that everybody needs to know, and the questions that patients should ask, like you, for example, or anybody else that sees this podcast or listen to somebody and they're like, oh my God, I have 3 of them, 5 of them, or whatever
Yeah.
number of them that I have, and I want to have them removed. Number one, look for somebody who's SMART certified. It's a rigorous certification through the IOMT where, you really have to know how to do it safely, and take the extra precautions so that the patient doesn't incorporate any more of this in your biology. Second of all, what you need to know is anytime a drill gets put to a tooth, there's always the risk that the tooth will require more treatment.
Okay.
So it's, where the tooth may have a mercury filling in there and is not sensitive at all. After we drill it out and replace it, you could then have sensitivity. Most of
True.
the time, it's a temporary sensitivity, but sometimes it isn't. And sometimes the tooth ends up needing more treatment. Worst case scenario, root canal, which is something that we want to try to avoid. But that's informed consent for you. And I'm big on that. That's why I was not happy with fluoride being in our drinking water, because that takes away informed consent. So informed consent is this: you have the facts and you're going to make a decision with your practitioner as to which way is best, but you're fully aware of the risks, benefits, and alternatives to the treatment. So also make sure that you ask your dentist these questions. Yeah, I want to safely remove them, but what are the consequences, possible consequences of me removing them? And if you're okay with that possibility, then move forward with it.
Most people, if they go to their traditional dentist and ask, hey, like I have these fillings, I'm an adult now, I've heard they're not good for me. Do you think I should have them removed? And I've asked that question. Their answer is always, if it ain't broke, don't fix it. If it's not giving you a trouble, just leave it there. And I remember every time being like, okay, well, you're the dentist, you're the expert. If you're saying that, why do I want to pay and suffer through a project that doesn't sound like fun anyway?
Right.
And The more I think about it, it's interesting putting mercury in the mouth, this metal that we would never use in any other area of our lives. We thought, or some select group thought, why don't we just fill that in their teeth? Could there not be a better innovation at this point? And the way you mentioned it'll take 9 years, like 125 countries agreed on this planet. That stuff's bad. We're taking it out. But over here in America, we're like, let's leave it another 9 years. Let's just see what happens to, I don't know, a couple 100 million more children and adults who get cavities over the next 9 years. It'll be fine. It's kind of a little bit like the gel nail polish conversation. So right now, finally, Europe banned gel nail polish. And when I go to the nail salon, I do polish changes only, and I've never used gel nail polish. Actually, no, I did it once. And when they took it off, I was like, we're never doing that again. That is insane that you think I should sit in a bath of nail polish remover? Do you know what we absorb through our skin? Everything. Are you guys insane? And so even now when I go to the nail salon, they're like, you don't want gel nail polish? As if I'm the idiot. And I'm looking at them like, are you crazy? Europe banned it. We're the only idiots who keep doing things forever, knowing full well it's toxic. And so that's what this sounds like to me. Like, we know full well it's horrible, but we just want to continue on because it's cheaper, faster, easier, and who wants to make a change?
Right.
That's insane. It's completely insane to me. So what is the material that they're going to replace it with?
So usually the material of choice should be some sort of ceramic restoration, and it depends on how big the void is, right? It depends on how much of the tooth structure we need to replace. We always want to try to rebuild the tooth back as biomimetically as possible. What that means is we recreate the tooth to proper form, function, and aesthetics to flex similar to what natural tooth structure would flex. The outside of the tooth flexes a different way than the inside of the tooth. And that's what biomimetic dentistry is. So for us, we prefer to stick to minimally invasive ceramic restorations. If it's very small, and some of these are very small, then we replace them with a resin restoration. Nothing is perfect in this world, but some resin restorations come with, okay, now I'm putting a plastic in my mouth.
Right.
Okay. So, we have to pick the lesser of both. I don't want to say evils, but the least, the what's going to biologically impact our terrain as least as possible negatively.
Sure. So when I came in, we talked about testing. You gave me a test. I never did that test, but I need to do it for the mouth. And you said, we need to understand what you're actually intolerant to. You say you're intolerant to gluten, but it could be a lot more than that. I also learned some materials used in the mouth can have gluten, which we don't even realize that we're gluten intolerant, and materials could be made with that.
Right.
And then you also talked about how, okay, Shivani, we can totally do this anytime you're ready, but let's talk about preparing pre and post. You need to show up healthy. And that was the moment where I was like, I love Dr. Maya. She totally understands. Every time I have ever gotten a surgery, I prepare for it like a marathon.
Yeah.
I take 6 months and I show up so healthy. I had a surgeon once tell me, I've never worked on healthier tissue. You are a joy to work on. And I was like, thanks. I'm such a good kid. I showed up gut healthy, brain healthy, lymphatic system healthy, tissues nourished, hydrated. So now whatever you do to me, my recovery should be easy. Like, I remember when I had a surgery a few years ago, 2 weeks later, I went to the gym and I was like, can I work out? And the owner was like, you sit down and watch. You are not working out here. And I was like, come on, I have the energy. I'm ready. And so will you talk about that a little bit? Because I think people don't understand that at all.
Sure. One of the tests that we run is called the biocompatibility test. And this test runs your personal body against any and all dental materials that we have in their library, which it's about a 400-page report. And it'll show us what you're least reactive to, most reactive to, and moderately reactive to. And if you have more than one or two restorations that need to be replaced, we recommend that, because then we're picking the cements, the ceramics, the resins, the bonding agents. We're picking everything that we're setting on our table for that procedure, we're picking it based on what you're least reactive to. So what I say to people is, imagine you were gluten intolerant and you had gluten, you'd have a bad couple of days, but then that insult would pass and you'd be okay again. But what if you were intolerant to something that became a permanent fixture in your body? Then what? Your body's going to try to attack it. Your C-reactive proteins go up. Your autoimmune response could, kick in, depending on your genetic makeup and lifestyle. So we want to try to, again, it's all about impacting biology as least as possible. Where when it comes with this biocomp test is what we call it, nobody is biocompatible with Mercury. And so, that's another thing too. That's another thing where patients are kind of on the fence when they look at this test and they're like, I'm definitely not compatible with the Mercury. That's one of the reasons why they might move forward to replace it. Where it comes to nutrition, again, it goes back to connecting the mouth to the rest of the body. So for us, before a patient goes into surgery, we recommend that they stay away from the core four, that they're hitting their protein goals. We put them on a nutritional plan curated by a friend of mine called Dr. Dominic Nischwitz. It's called the Bone Healing Protocol. And that's what we recommend. This weekend, there was one podcaster who criticized dentists for trying to be nutritionists. But if we don't have a good understanding of nutrition, all doctors, no matter what specialty, need to have a proper understanding of nutrition and be able to recognize if their patients' bodies are in hibernation or if their patients' bodies are anabolic. And what we're asking our patients' bodies to do when we go through surgery, dental surgery, extractions, implants, cavitation surgeries, we're asking the body to become anabolic and heal. And so, how are we going to do that if we don't pay attention to the way the person is eating? So we do our bone healing protocol 4 weeks pre, 4 weeks post. It's based on avoiding core four, gluten, sugar, dairy, bad dairy, and vegetable oils, and making sure that the patient hits their protein goals, whether they eat meat or not, and making sure that their micronutrients and macronutrients are in line. D3, K2, magnesium, zinc, boron, digestive enzymes, all of that plays a role because we know that what we do on the level of the mouth needs help from the rest of the body and vice versa. So to be able to practice this philosophy of care, we have to be able to guide our patients towards the right nutrition, especially when it comes to dental surgery.
Hi, I'm Dr. Shivani Gupta, and I created Fusionary Formulas because I believe everyone deserves a natural way to support their body's health. If you struggle with joint discomfort or stiffness, our turmeric gold delivers powerful curcumin in a form your body can truly absorb. It's science-backed with the highest quality ingredients and designed to support your body's natural inflammatory response. Take the next step in your health and wellness journey today. Visit fusionaryformulas.com and use code FusionaryHealth for 15% off. Fusionary Formulas, ancient wisdom, modern science, maximum impact. For sure. And I remember you mentioned IV vitamins, and I thought this is so smart. 90% of us, 99%, I would assume, are going to show up without total nutrition. Diet can be off. Stress can be affecting gut health. You never know where someone's absorption lies. So, of course, walking into a surgery like this, you're going to ask the body to heal after. Showing up really healthy for something so big matters. And it's actually why I chose not to do it this year. I knew that by this summer, I was going to be into a book launch mode. I have a book coming out. And it's so intense, the game planning and teamwork it takes to get a book off the ground. And I thought, this is not your year. But the minute you're past this thing, you can make space. You can make sure you're healthiest, you're feeling your best, you're not pushing your schedule on all sides. And I just really appreciated that you were like, look, we even talk about IV vitamins and all these solutions and coming in with what is that game plan pre, what is that game plan post? Really having that deep conversation around nutrition and total body health and supplementation, because yes, I could walk in as is and do this. But then you're asking the depleted body to be in charge of the rebuild. And how is that the best way to go? So I completely agree with you.
Yeah, for sure. And I have to say, one of the most common dental surgeries that most people have starting from the age of 16 to 25 is wisdom teeth extractions.
Yeah, I was going to ask
And
you.
I would definitely like all of your listeners to know that they should get second and third opinions before they remove their children's wisdom teeth. And
For
sometimes
sure.
they indeed, under certain situations, indeed need to be taken out because they're affecting other things. But if they do, make sure that your kid's body is anabolic and prepped for that surgery. Otherwise, the area won't fully heal. It'll heal from the outside and not from the inside. And then a potential cavitation will form, which
Yeah.
could potentially affect them for the rest of their lives. So that's one of the things that I wish we talked about more. It's not a rite of passage. They're way overdone here in the US, and we do
Yeah.
them. We do them here. But when we do them, our patients are nutritionally fit, and we're making sure the ligament that gets taken out, that the we're using PRF, and all of that stuff. But that's one of the most major when we're talking about nutrition and we're talking about surgery. That's one of the things that we're seeing often very much overlooked and taken way too lightly. I think it's my opinion in the dental
Yeah.
field.
Yeah, I mean, if you think about it, what are these different rites of passage? You take your kid to the dentist. I took mine too late. My first one had lots of cavities. I was like, what? So I ran and got second opinions. When she did go to get the cavities, I had some awareness and I asked, hey, what are you going to use? They're like, don't worry about it. What's the big deal? Like, we just use what's current. And I just remember the dentist being so dismissive. And I thought, I'm asking you for health reasons. The kid has an autoimmune condition. Like, it's my job to safeguard this. Then fast forward, you move forward with that. Thank God my kids have not needed root canals, and thank God I've now found you, so I know where to bring them. But you're right, wisdom teeth is the next big what we call rite of passage in the US. Everyone gets their wisdom teeth out pretty much. And not to mention orthodontists. So nowadays, everyone I know is told, oh, you have a 7 and 8 year old. We need to expand the palate. We need to put those braces in. I have done braces up to 3 times now on my kids where they're like, we have to expand again. They all moved, braces again, retainers. And I'm like, I feel like we're just torturing the mouth and we're forgetting that some of us are meant to have, like, I don't know, I want beautiful straight teeth, but I feel like we create a lot of pain and we create a lot of, I don't know, it feels like abuse to me. So what are your thoughts on orthodontistry, the way it's practiced right now?
I think it's very important to go to a airway minded orthodontist
Sure.
because as the patient's biology is still developing and growing, if we have a narrow palate, for example, then we may be able to use that growth to our advantage and expand the airway. And so on that point, it's very, very, very important. And I think most orthodontists are with it. The orthodontics of the past where, it was an automatic extraction of 4 premolars and everything was shoved back. And now we're seeing a whole lot of adults with sleep apnea because they're, like Dr. Felix Liao says, they're 6-foot tigers trapped inside 4-foot cages and they're not able to breathe. I think that's for the most part a thing of the past. I haven't met one orthodontist recently who isn't airway minded. And now that most research is coming up with that, I think that they are. And again, everybody, no matter where they go to, even if it's a biological dentist, you have the opportunity to do your due diligence and seek second and third opinions and then figure out who you're most comfortable with and in line with. But I think orthodontics is very important if there's an airway issue, if there's a bite issue. And by the way, that stems from most of the time that stems from, we become too soft. So we're eating over processed foods from when we're kids. Our
Yeah.
tongue is not in the right position for the arch to develop. There's not because of how the mothers are in the workforce. And I'm not criticizing that. I am a mother in the workforce. There's not a lot of time for breastfeeding, and breastfeeding really is the first orthodontics
Mm.
for us. teaches, it's that natural myofunctional therapy, which is super, super important, teaches how the jaws to start forming. And there's a big lack of that.
Yeah.
And so that's why we have the need for more and more orthodontics. But
Interesting.
yeah, I am for orthodontists. I'm for early screening of airway. I think it's very, very important. And then I think the post-op is very important, making sure that the family follows through with the retainers, follows through with all of that stuff to prevent relapse, I think is very, very important. I get oftentimes asked about the materials because
Sure.
we try to stay away from metals in the mouth as much as possible. And we all know that most orthodontics involve metals. So when possible, for example, I took my daughter, she needed ortho, she needed expansion. So what we ended up doing was a compromise. We ended up doing ceramic brackets, which
Mm.
were, we have a great person in town that does ceramic brackets. And so the only thing metal was the wire, and that's a temporary metal. It's not ideal, but we don't live in an ideal world. And in order to, I wouldn't let her stay, collapse or compress in order to avoid putting metals or using metals. That's where biological dentistry is different because we're very much into, okay, modern medicine. Let's use common sense. Let's use a little bit of this and a little bit of that, but try as best as possible for it to be temporary or biologically sound. So there are a lot of options. When it came to my youngest, he had some major airway issues. We didn't have the option of doing ceramics on him.
Got
And
it.
so he was fully metal brackets and wires for a short period of time, and he's done with his phase one. But we're making sure that we definitely use his retainers because we don't want to lose the progress as he
Sure.
continues to develop. So I know that was a long-winded answer to your question, but it's a question I get all the time from parents. And so find an airway minded orthodontist, get a second and third opinion, pick the person that is willing to work with you on material as reasonably as possible on both ends. And,
Sure.
um, and then make sure the follow through with the retainer is very, very, very important.
Isn't the retainer made of microplastic and metal?
So the retainer is depends. It depends on what type of retainer you have. So when you go into a retainer, I don't want to list brands, but some retainers are a little bit more stiff, made with a plastic that is specially formulated, three plastics fused in to each other,
Okay.
so that when the patients are biting against, there's nothing coming off
Sure.
and being incorporated into
Yeah.
the like if
You're
we lived
not.
in a perfect world, we wouldn't need retainers and we wouldn't need ortho, but
Sure.
we've become soft.
Yeah.
And so we need to be able to mitigate, and hopefully after this period of time where we're doing a lot of corrections to previous dental treatment, hopefully the future we won't need that because we're becoming more aware of what we're feeding our children. I was in a meeting yesterday. There's this amazing group of moms that are gung ho about getting organic farm to table food for school, um,
Awesome.
for school lunches. So the evolution and the revolution is here. So I think hopefully in the future we'll need less and less of that.
And when you say soft, what you're talking about is soft, mushy food. We're
Yeah.
all eating food that's easier to eat. We don't want to work for chewing things, which is true. Sometimes I'll hear people say, you know what? I don't want to eat a salad. Like, that's just too much work. And the problem is, if we're not using our mouth, it's going to get soft. So, will you speak into that a little bit and explain it for people?
Yeah, absolutely. It goes back to Weston Price, who I know he's very controversial as far as his research, but he went to, tribes that, still gathered their food and ate a lot of raw diet. And he examined their teeth, and not only were they cavity free, but they were, properly formed. And so he came to the industrial world and took a look at how we started eating over processed foods and found that everybody was collapsed, everybody was crowded. So the mere fact that you have to use your tongue to breastfeed, the muscles to breastfeed, and then once you're able to chew food, actually make the work to chew it where the tongue is in the proper position decreases the risk in the future of needing orthodontics.
For sure. You know what's interesting is how many people who are listening probably don't realize tongue placement and where it's supposed to be. I went to the orthodontist when we were finishing up with my first child, and she said, just so you know, she doesn't put her tongue in the right place. And I looked at her and I was like, what are you talking about? She's like, yeah, you're supposed to park your tongue at the top of your mouth. And I looked at her and I said, that's weird. I don't do that either. She goes, Shivani, look it up on YouTube. There is something called correct tongue placement, and you're both doing it wrong then. And I'm sure that's what's affecting your bite. And what I realized was at night, I am grinding. I went to ENT and learned that. But I'm also jamming my tongue against my teeth, and it is causing them to move. And I don't like Invisalign because I drink tea all day. Literally like an addict, I'm sipping tea all day. So Invisalign is a big problem to take it in, out, and all the things. So choosing not to do it, but I think those of us who have incorrect tongue placement need to go hire a coach. I met someone who writes books on this, and it's just a matter of going to get the like OT, occupational therapy, or whatever it is. So will you teach them all my listeners?
Functional therapy.
Yeah.
Therapy. There are some great myofunctional therapists out there and myofunctional programs for kids out there, for sure.
Nice. Will you explain the importance of it for those who are wrong tongue placement crew?
Wrong tongue placement has a lot of ramifications upstream and downstream. At rest, the tongue is supposed to be pressed up against the palate, like that. And there are some exercises that myofunctional therapists will do to help to retrain that. What happens is so many things happen. So if your tongue isn't resting up against your palate, your arch on the upper doesn't form properly. Okay. So then you end up forming crowded arch. Then the lower arch follows the upper arch. So you're crowded on the bottom. That's one thing that happens. The second thing that happens is the tongue. So then you're crowded, right? So then your tongue becomes too big. It's again that 6-foot tiger trapped inside that 4-foot cage. I don't take credit for that. Dr. Felix Liao takes credit for that. And I think the man is an absolute genius. But so your tongue then becomes too big for your mouth. So if you stick out your tongue and you see a lot of like little scallops on the side, that's one of the things we do with our patients. You'll know that the tongue, number one, isn't sitting on the top where it belongs. And number two, it's fighting. So it's taking up room. Number three, what happens is airway. So then the tongue drops down and sits backwards instead of going forward and up, and your airway is compromised. And that ends up the patient that has potential airway resistance syndrome or potential sleep apnea because there's not enough space anywhere.
Sure.
So yeah, myofunctional therapy works. All orthodontics that I refer to work with myofunctional therapists or know enough to recommend myofunctional therapists because again, you're going to get everything straightened out and everything expanded. But if your tongue isn't sitting in the proper position, everything will relapse.
Correct. Of course. It makes total sense.
Yeah,
so we've talked about a bunch of, sorry, go ahead.
No, I'm just saying it's very, very important. Tongue posture is very important.
Yeah. And most of us may not realize it. And then we're causing ourselves to need orthodontics again.
Yes.
So we've talked about root canals. We've talked about fillings. We've talked about wisdom teeth, and we've talked about orthodontics. This is kind of the scope of what I care about or have dealt with. We haven't covered fluoride. And let me know if there's any other topics around oral health that are common with with the people who walk into your office and are like, hey, I'm coming in with this problem. How can you help me? Let me know what other topics we haven't covered. And then please explain the issues with fluoride and fluoride toothpaste.
Fluoride is a big hot topic here and very much misunderstood. Fluoride comes from fluorine. It's a halogen, and it's actually the most reactive halogen. What does that mean? That means as the most reactive halogen, it's going to replace and displace anything very, very quickly. So it's great for speeding up formulations in industrial companies, but in biology, what that means, it's going to displace iodine. It's going to replace calcium. It's going to interfere with enzymatic activity down to the mitochondrial level. And it's not essential essential for any type of body function in any way, shape, or form. Everybody needs to know that cavities are not from a fluoride deficiency, as fluoride is not essential in any way for human development or processes. So here now, knowing this, knowing what fluoride exactly is, and it's a naturally occurring element in on the earth. So some well water has a natural occurring form of fluoride, but there's a difference between the natural occurring form of fluoride and the fluoride that's being put in the water. But let's pause right there and then skip to the fact that there are two things when it comes to fluoride. Now that we know what fluoride is and what it does in the body, there's topical fluoride and there's systemic fluoride. Topical fluoride is what you put on your teeth. So that's your fluoride treatments, that's your fluoride toothpaste, okay? That's
Right.
topical fluoride. And it works because it makes the outside of the body, it replaces the calcium, so it makes fluoroapatite in the tooth enamel. So it makes it hard, more resistant to decay, but also very, very brittle, okay?
Mm.
The other thing is systemic fluoride, and this is where the whole issue is confused among dental professionals and most people. Fluoride was added to the drinking water almost 70 years ago. The fluoride that's being added to the drinking water is not the naturally, it's not like we're chipping away the fluoride in the soil and sprinkling it in the water. It's hydrofluorosilicic acid. It comes from phosphate fertilizer waste. It's actually captured in smokestacks, shipped to the water treatment plants and put in the water there. It has never actually been approved by the FDA for human consumption, but they're promoting it. Over the past 70 years, they've done very little research to see what it happens in the patient's biology. And they base their toxicity of fluoride based on skeletal fluorosis. By the time you have skeletal fluorosis, you're completely debilitated. Okay.
Wow.
And so they've lowered it down to this part per million, down to this part per million, down to this part per million. And they can never agree on what the safe part per million is, which currently is 0.7 part per million. But since water was added to fluoride was added to the water, fluoride products came out. And
Sure.
so you have the topical and you have the water. And now how are you guaranteeing how much dose you're getting? As a halogen, fluoride is a developmental neurotoxin. That means that it's not only dose dependent, it's timing dependent. So it's being added to the water without measuring the risk between a 5-year-old drinking an 8-ounce glass of tap water and brushing their teeth with fluoride toothpaste and maybe swallowing some and getting fluoride treatments from their dentist versus an adult who's doing the same. So how do we know what's safe? The new research is out there that shows that there's higher risks of neurodevelopment, IQ issues with children who have too much fluoride.
Yeah.
Then the issue of informed consent. The definition of a medicine is something that is given in order to treat a disease. Dental decay is a disease. It's actually the most prevalent disease in the world. Okay, in all countries. And so what we're doing in essence is we're adding hydrofluorosilicic acid captured from smokestacks in industrial companies, putting it in the water and forceful medication of the entire population. That
Right.
takes away our informed consent to decide. Now, people who promote fluoride in the drinking water say, well, you're not accounting for the low socioeconomic people who don't have access to dental care, who need the fluoride in the drinking water. Studies show that topical fluoride works better than systemic fluoride, if that's what you're worried about.
Sure.
Studies show that the decrease in cavities happened at the same rate in countries that fluoridated their water versus countries that didn't fluoridate their water. And then back to socioeconomic. Some parents don't want their kids to ingest fluoride because they've done the research. Do you know how expensive those filters are?
Yes.
They're
I have them.
very expensive. So I have them too. I have the luxury of having my whole house filtered.
Me
But
too.
not everybody can do that. Those filters are expensive. And so what about the lower socioeconomic mom who wants to keep her kid safe from this neurotoxin because she has read the new research on the
Sure.
brain development and fluoride. What about her?
Yeah, she can't filter
What
the
about
water.
her? She can't filter the water. She can't afford that.
Yeah,
So, I'm very happy that as of June, Florida is fluoride free.
thank
Um,
God.
but there are other countries, there are other states, excuse me, that are still having fluoride, and the fight isn't over yet.
Sure.
If you choose to have fluoride for the sake of cavities, use it topically. But let's not put teeth first and children's brains second. Let's
I
not do that anymore, okay?
I agree completely. I think it's insane the number of things we do in America in the name of health that are completely destroying our health in such a profound way. It's truly insanity to me. So once I learned, I've been to so many beautiful detox centers around the world. It's my world to be an Ayurvedic practitioner. And once I learned all this in my 20s, I started putting in so many safeguards, and the moment I decided to have children, I completely pivoted on house water filtration, air. I mean, I'm pretty obsessed with these topics. And that's why this year, dealing with mold in my house, I am game on, completely focused on how we manage this, because it's our entire mitochondrial health, immune system, brain health, everything gets affected. And
I
so it's
mean,
interesting when you said fluoride.
you said it yourself. The skin absorbs everything when you were talking about nails. So we're
Yeah,
forcing people to shower in this now?
correct, which is insane. And what you said about fluoride was iodine, you said calcium, and you said mitochondria. And the moment you said it, I thought, wow, think of our country. Thyroid dysfunction abounds. Every woman past 45 or so is told you are osteoporosis, you have osteopenia, you have bone problems. Why all of us? We're all trying to eat pretty healthy here. And then mitochondria, what are we all chasing in the longevity biohacking space? We're saying we're tired as we age. Can someone please give us more energy? Well, the water you're drinking is literally taking everything out of you. So no wonder we're affected, right?
For sure. I get very passionate when it comes to this because we were indoctrinated in dental school to only understand the topical benefits of fluoride and not to fully understand the systemic effects. And since then, new research has come out, which everybody should stop,
Yeah.
especially dentists. Stop what you're doing in your practice and just read the research for yourself and make a decision. I'm not going to force you to make a decision either way, but please
Yeah.
stop and read the research.
I was in the dentist office. I mean, I take my kids every year, even though I avoid it like the plague. I don't want to hear anything from them. And now I'm only coming to you for our big intellectual conversations about game plans for my mouth. And I remember when I went, they were like, okay, well, a fluoride treatment. I said, no, we're good. We brush our teeth. We're fine. We use fluoride free toothpaste in my house. We're good. And he's like, okay. It was like a different orthodontist. I mean, a different dentist we saw that day, not the typical one. And then he's like, how about mouthwash? I'm like, no, I don't need to kill the nitric oxide in my children's mouth. He's like, what are you talking about? I'm like, you haven't read the research on mouthwash? Certainly no. They're children. The last thing we keep in my house is mouthwash. And he's like, oh. And I said, I teach. I didn't even get into it. A lot of times, if someone has no reason to listen to me, I don't get into it. But I'm like, we should all tongue scrape, oil pull, and brush our teeth. We've got this, guys. And we should work on our body health, because that is our oral health as well. And so, do you have that conversation with your patients as well? Like, say no to fluoride treatment. You don't need it. And then let's talk about mouthwash, and just don't use that either. And so I know you were recently at a conference where I was, and you're starting to talk about really safe, clean, better toothpaste that we can use for our daily health. So will you share a little bit about that?
Because now we have access to hydroxyapatite, which is the mineral that enamel is made out of. It's safe, it doesn't have toxicity, and it helps to remineralize teeth. So a lot of patients will stay away from fluoride because they know enough not to put fluoride on themselves or on their families, but then they'll go to a natural toothpaste that doesn't have an active remineralizing ingredient, and that's where they fall into this trap, and that's where they go for their checkup and they have cavities. So I have to interject here that cavities are a metabolic disease. They're not a factor of not brushing or flossing enough. Hygiene is important, but it's really what the body is doing as far as acidity is concerned. So the acidity of the mouth drops below 6.8, no matter what you're doing, you're going to get a cavity. So back to the toothpaste, which is important for hygiene. It's one piece of the puzzle, right?
Yeah.
We want something that has hydroxyapatite in it that will remineralize the teeth. So go away from a fluoride toothpaste, but use something that is going to remineralize, because most of us don't eat a perfect diet.
Yeah.
And most of us need that remineralization because we're not living in a perfect world. So,
Got it.
I like a lot of the products out there. I like Boca. I like Fig. I like Dr. Nishwitz is coming up with a new one called More Than Just a Toothpaste with probiotics in it. I like Risewell. I like all of those toothpastes. I don't have financial gain really in any of them.
Okay.
Um, but yeah, something that remineralizes safely is what should be used.
Got it. We could have a whole second conversation because we've covered a lot of topics today. It's almost like we laid the foundation. And I am so glad we had this time together. I wanted to leave room for you to share one or two patient stories because that always illustrates to the audience like why someone would come to you. So will you kind of outline for the listener today, if they have questions about their oral health, what are those key reasons they should come to you? And maybe share one or two patient stories that really stand out to you.
For sure. I mean, usually by the time somebody seeks out a biological dentist, it's either because they're suffering from autoimmune conditions or certain conditions that medicine can't explain. So, it's not always that they treat their interferences, which is what I call them, in the mouth and get 100% resolution. It's not always that.
Mm.
And our patients know fully well that they can go through all of the treatment and maybe feel the same, but biologically they'll be cleaner and healthier. But one patient that comes to mind is the patient who had really bad headaches all the time and went to the world's top neurologists and hormone specialists. And, nobody could figure out really where his headaches are coming from. And as it is, I was the last person he came to because somebody said, "Hey, did you check out a biological dentist? Did you look in your mouth?" So when we looked in his mouth, he had something called oral galvanism. So he had many dissimilar metals in his mouth. So he had
Wow.
gold and he had porcelain fused to metal and he had stainless steel. So he had over the years a bunch of different restorations with a bunch of different metals. So metals in an aqueous solution, which is an electric conductor like saliva, can form its own current. And that's called oral galvanism. So I looked everywhere. I didn't see any cavitations. There was one root canal, and the rest were, and it was failing, had a big infection outside of it. But the rest were all dissimilar metals. And I said, "Listen, this is a long shot. You've been trying to deal with this for years, but let's remove all of your metals and see if anything improves, and the root canal that's failing." And so, of course, like I do with all of my patients, these are the risks, these are the benefits, this is the alternative, this is what could happen, what could not happen. And there's no promise that anything will improve. But he agreed because he had done his research and he didn't want any metal in his mouth anymore.
Yeah.
And lo and behold, his headaches went away.
Wow. I
And
wonder.
so, it's not always magic. Everybody needs to know that it's not always magic. It's not always that symptoms resolve. Most of the time they improve, but not always that 100% they resolve. And we both know, me and my patient, that their biology is just better off because we put something cleaner and more modern in there. But there are stories and stories and stories like that, which makes for me my day to day worthwhile, and is what, professionally, outside of my personal life and my children and family, professionally, what really motivates me to wake up in the morning and come and see how we can help our patients. So we don't heal our patients' bodies heal, but we help our patients' body to be able to heal, maybe for the first time in a long time, for the most part.
Sure. I mean, have you seen people come in with autoimmune conditions that get resolved, migraines that get resolved? I mean, there's so many issues we're seeing where people are taking more and more invasive levels of medications and things, and they're not finding relief. So, have you seen that as well?
Yes, we have. Yes, we have. We've seen where somebody took a scan and there was something that they saw in the lungs. And then when we took out the root canal and did, every time we take out a root canal tooth, we do a DNA connections test on it.
Okay.
And that's where they take the tooth, they split it open, and they do a PCR evaluation of everything that was inside that root canal. And
Mm.
that report came back with over 22 different species of lung related pathogens.
Wow.
And so, anyways, the reason why she was in our office to begin with is because her functional medicine doctor would not treat her for anything until she got her mouth cleaned up,
Yeah.
which, hopefully everybody's seeing somebody like that. And so we cleaned her up, cleared her to go back. When she went back, they updated the scan, and what they saw was gone.
Wow.
So, yeah, I mean, like, there are so many stories like that. There are so many stories like that. Um, you know,
Yeah,
so
I get it. I get it. And I go to functional medicine. And functional medicine recently, I went this year. Every 2 years, I change doctors. I learned so much from each one and I love each one. And then I'm like, okay, we're good. I've done my work. I'm moving on to my next frontier of what I need to work on for my health. And my most recent one sat me down. She goes, I'm going to show you a 2-minute video on the off gassing that happens from your fillings. And I thought, I don't want to waste 2 minutes of this appointment. I got so much to talk to you about. We have mold detox to figure out in this body. And I don't even have time for that detox. And she's like, I'm just going to show you this video. And I saw the video and I thought, oh, holy God. If every time I chew and brush, my fillings are off gassing into my mouth. And I already know that from a health standpoint, I've struggled with my health my whole life. Maybe that's where it started when I was an 8-year-old girl and they were like, let's put 8 fillings in this girl's mouth. And then from then onwards, I wondered, why am I always sick? Why am I always struggling? Final question before we wrap. I know a lot of people are scared to do this. It's almost like you're opening a can of worms. I know that was my hesitation. I was like, oh, what if I get poisoned from mercury? Like, you're opening up a new problem. So if there was anyone who was going to work on my mouth, it's you, because I've met you and gone through the whole process now. What do you say to that, to those people who are worried?
I think it's I think it's a good thing. I think you should hesitate anytime somebody wants to take a drill to your tooth.
Yeah,
You
I
should.
agree.
You should ask questions about materials.
Yeah,
You should. It's not a normal state to be in.
right.
And so I would say for me, whenever I feel something like that, I don't try to ignore it. I try to sit with it. I sit with it and I acknowledge it. And I try to understand what that feeling is telling me.
Sure.
And we don't want to ever underestimate spirituality or intuition. So, but what I can say is don't let fear stop you from being the better version of yourself. Let fear guide you and turn it into protective instinct instead, if that makes
Absolutely.
sense. But
Yeah,
sit with it, understand it. Is it a past experience? Is it unreasonable? Is it where you need a little bit more explanation? And trust. There are certain situations where you know, not every patient is meant to be treated by me. And I'm not meant to treat every patient because for me, the relationship is what's most important. I don't say that with being stuck up. I'm not for everyone, and everyone is not for me. So making sure that you trust the person that you're going to, ask questions, make sure that you trust them before you move forward with the treatment. And it's the same thing because if anything happens, we need to be able to walk hand in hand together and solve problems. And so it's really important to be able to trust, but try to understand where that fear is coming from for sure.
sure. I know where it was for me. I met someone and they said I had mercury poisoning. And I was like, well, who'd you go to? How'd you go to them? What happened? What was the preparation? But in my mind, I thought, okay, so if that's a potential punishment, you need to know when you're going to sign up for this project. So for me, I can typically say every summer is when I have a little downtime. I have the space to focus on any big project for my health, or usually it's my creative projects, writing books and things like that. And so that's where my body was like, you're going to do this, but you're going to wait and you're going to do it when you're ready to really honor and respect that this is a big life project to sit down and do. It's your mouth. Your mouth is your health. This is everything. It ties to everything. So thank you, Dr. Maya, for coming on here today. I'm going to personally be texting this episode to all of my family and friends. There's some episodes where I'm like, everyone needs to know this. Do they not understand our children's health destiny? We are deciding right here and now. And then our own health destiny was decided oftentimes as children. And here we are at the most beautiful moment to make informed choice around how we manage our health going forward. I'd rather do something big and invasive in my 40s when I have the ability to withstand it and then get to benefit from that health choice for the next 50 years going forward.
Yeah, and resilience. We need to be able to, as dentists and practitioners, recognize whether or not our patients are resilient. And sometimes it's okay. Let's delay this for 6 months. Let's delay this for a year. Let's get you resilient so that this is a proper outcome for both of us. Both of us have stake in this treatment for sure. But thank you so much. Thank you so much for having me on. I always love our conversations, and I feel very blessed to, be able to share in your platform. Thank you for having me.
For sure. And Dr. Maya, will you share where everyone can find you?
So on Instagram, they can find me at dr.maya Assi on Instagram. And then we are at Alpha Dental Practice and Implant Center here in Coral Springs, right off of Sample Road.
Perfect. And so what's your website? Alpha Dental?
alphadentalpractice.com. And we've created another website just to explain biological dentistry because there's so many questions associated with it. So we have biological dentistry Florida.com.
Amazing. Thank you for that. We all need to read more, understand this topic more. It is it's not new, but it's still emerging in terms of people's awareness of it. So thank you for that. And thank you everyone for listening today. Please share this episode with someone you love in your life who could benefit from this knowledge. My goal on this platform is to share all the incredible practitioners who are showing us different approaches to our health. For more info on the Fusionary Health Podcast, you can visit my website at drshivani.com. Have a beautiful week, everyone, and I'll see you next week. Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health Podcast this week. You have the power to transform your health and achieve vibrant health starting today.